Hello, everyone, and welcome back to Vibrant Midlife. I'm your host, David.
And I'm your helpmate, Emily. David, today we're tackling the topic that is so important for our midlife audience and one that can feel very overwhelming, especially after a new diagnosis. We're talking about managing blood sugar and type 2 diabetes.
It's a topic that affects so many people, and there's a lot of fear and confusion around it. When you first get that diagnosis, it feels like your life has to completely change overnight.
It does feel that way, but it doesn't have to be a story of fear. It can be a story of empowerment. Today, we're going to break down the essentials of blood sugar management into a practical, real-world survival guide. This is about understanding your body and taking control.
So let's start with the basics. What exactly is happening in the body with type 2 diabetes?
In simple terms, your body isn't using glucose or blood sugar for energy properly. This is usually because it's either not producing enough insulin or the insulin it is producing isn't working effectively. Consistent management is key to preventing or delaying serious complications down the road that can affect your eyes, kidneys, nerves, and heart.
So what's the first step someone should take after a diagnosis?
The very first step is to start monitoring your blood sugar at home with a glucose meter. This is your personal data center. By checking at different times, before and after meals, before bed, you start to learn how your body responds to different foods and activities. It's not about judgment, it's about information.
That makes sense. You can't manage what you don't measure. And what about the numbers? What are we looking for?
The most important number your doctor will track is your HbA1c. This gives a 2 to 3 month average of your blood sugar, with the target usually being below 7%. It's incredible, but studies show that lowering your HbA1c by just 1% can significantly reduce your risk of long-term complications.
That's a powerful motivator. Let's talk about the scary moments, high and low blood sugar. What do we do?
Great question. Hyperglycemia, or high blood sugar, is when your levels are consistently too high. You might feel thirsty or need to urinate frequently. The key is to drink plenty of water and follow your doctor's advice. But hypoglycemia, or low blood sugar, usually below 70 milligrams per deciliter, is more urgent. You might feel dizzy or sweaty. This is when you need to act fast.
What's the protocol for low blood sugar?
It's the 15-15 rule. You consume 15 grams of fast-acting carbs, like half a cup of juice or a few hard candies. Wait 15 minutes, then recheck your blood sugar. If it's still low or you're not feeling better, it's important to seek medical advice.
That's a very clear action plan. Now, let's talk about the big lifestyle pillars, diet and exercise.
For diet, the key is consistency. Eat balanced meals at regular times to keep your blood sugar stable. You don't have to eliminate carbs, but you do need to manage them. Learning about carbohydrate counting is a game changer. Focus on increasing fiber and reducing unhealthy fats.
And for exercise?
The goal is at least 150 minutes of moderate intensity aerobic exercise per week. That's just 30 minutes, 5 days a week of something like brisk walking. Combine that with 2 sessions of strength training. And always, always, always talk to your doctor before starting a new exercise routine.
Safety during exercise is important too, right?
Absolutely. Check your blood sugar before and after you exercise. Always carry a snack in case of low blood sugar and wear proper footwear. Another crucial pillar is stress management. Stress can directly raise your blood sugar levels. Finding healthy outlets like exercise, deep breathing, or a hobby is essential.
And what if lifestyle changes aren't enough?
Then your doctor may prescribe medication, either oral drugs or insulin. It's vital to take them exactly as prescribed and to inform your doctor of any other medications you're taking, as some can affect blood sugar.
This is such a comprehensive guide. It makes the whole process feel much more manageable.
That's the goal. The most important member of your healthcare team is you. These are not drastic, impossible changes. They are small, consistent efforts that add up to a huge positive impact on your long-term health.
Thank you so much for this, Emily. In our next episode, we're going to dive into a fascinating topic, the slow jogging revolution. how a slower pace can change your life. This has been David.
And I'm Emily.
Stay
Stay
vibrant,
vibrant, everyone.